The reason I think for the popularity of this evening's event, well, I'm absolutely certain of it, is that my distinguished colleague, Professor Anthony Costello, is going to give our speech this evening. So it's great to see Anthony, who I worked with for a number of years, and I know he's going to give, as he always does, a really great presentation. So something about Anthony. After studying Cambridge, Anthony trained in paediatrics and neonatology here at UCL. But early in his career, he spent 2 years in Western Nepal with Save the Children, where he became fascinated by the challenges of working with poor, remote populations. He then returned to work here at the Institute of Child Health with the late David Morley, who had established the Centre for International Child Health here, and who was a figure of global stature in paediatrics and child health across the world. So Anthony continued to work in Nepal, and in the early 2000s pioneered something that he's going to be talking about this evening, a large community trial of participatory learning and action using women's groups, women working together, talking together, finding solutions to their problems. And this amazing work was extended into India, Bangladesh, and Malawi. And I was amazed when I saw the systematic review that covered all the trials to see the extent to which maternal and neonatal morbidity and mortality was significantly reduced as a consequence of this work. Anthony was also a keen educator, teaching in the Institute's master's course in community maternal and child health and disability, and a commitment that he maintained when the Institute of Child Health became part of UCL in the 1990s. And there are alumni here, I know, from that programme tonight, and again, undoubtedly as a consequence of Anthony's presence. So when Andrew Tompkins stepped down, Andrew's here this evening as well, as head of the centre in 2006, Anthony became the director of the Centre for International Health and Development, which he and I worked to transform into UCL's Institute for Global Health. So out of that department came one of our strongest institutes in the faculty, the Institute for Global Health. So when he was head of the Institute, Anthony promoted cross-disciplinary research and teaching in global health, including leading 2 Lancet commissions on climate change and health. His work has been taken by WHO out into low and middle income countries, recommending the intervention for a wide-scale scale-up. Sadly, we lost UCL to WHO in 2015, but there he did amazing work, again, as Director of Maternal, Newborn and Child Health, and that work continues to this day. So he's completed his stint there. WHO has a compulsory retirement age for people of a certain age, unlike UCL, much as some of us would like to see that. But now Anthony's got time on his hands, is able to come and speak to us, meet old friends and colleagues, and I'm absolutely delighted, as I said, to welcome Anthony back to give tonight's lecture. And he's going to be talking about wicked problems, how to deal with them in policy and practice. Thank you very much, Anthony.
Thank you. It's lovely to be back in the warm embrace of Nanny UCL. And I'm so grateful that you've all given up the chance to go and watch the One show in Hollyoaks to come and listen to me. And I'm going to talk about, how do I work this? I'll just keep it, I think. So I'm going to talk about three things. The power of sympathy groups. I'll explain what I mean by that at the social edge. I'm going to talk about experiments on cooperative nurturing for infant survival and how sympathy groups might tackle 21st century problems. But first, I'm going to talk about the World Health Organization, because I thought, as I've just spent nearly 3 years there, and it is quite an important organization, I should say a few words about it. And think of me as a WHO Goodwill Ambassador in place of Robert Mugabe, who unfortunately can't be with us tonight. The day I arrived at WHO, I got shown in and obviously went to the cafe where I did subsequently most of my work. And I met with that guy, Andrew Cassels, who just retired as Director of Strategy. And Andrew said, "Oh, hi, Terry, jolly good you're here." He said, "Do you know how many people work at WHO?" And I said, "No." He said, "About half." And I thought, oh my God, this is awful. It's going to be like UCL, you know. Anyway, it turned out not to be like that. I mean, like all these places, you've got your odd dud. But actually, most people are very passionate, and certainly in all my team, everyone worked their butt off. And it was fun. And then about 2 weeks after I started, this thing broke, that this woman, Vanessa van der Linden, who's a pediatric neurologist in Brazil, usually would see one case of microcephaly a month, and she saw 8 in a day. And she and her mother ran this clinic, and then they phoned up a friend, and they realised that there'd been this new virus around. And they were very clever, they put 2 and 2 together. And I'd never heard of Zika virus. And then a week later, I was on the BBC talking as a world expert on a virus. And I just felt really at the time that being able to talk knowledgeably and with authority about something you know very little about is something that UCL prepared me for. I feel UCL is, Masters in Bullshit is very good, you know. But the thing about people don't know what WHO does, which is a real problem. It took me about 6 months to find out. But one way of summarising it is it's got soft power. The first thing you can do is convene a meeting. And if you convene a meeting, say you've got to come to WHO, everyone kind of comes. They sort of miss the funeral of their parents or something and just say, "Oh no, I've got to be at WHO." So this is a big early child development meeting that we held about 2 months ago because we've got a big strategy coming on with lots of world experts. This was the Japanese got into home-based records. Where's Andrew? Yeah, home-based records have come back. David Morley is revivified. And they said, we've got to do home-based records because it's a human rights issue, which I hadn't thought of. I thought it was a sort of tick box for immunisation. But actually, it is a human rights issue. They're quite right. So that was another example. And then there's the World Health Assembly. So do go to the World Health Assembly, just create an NGO and ring them up and say, "We've got to come." And it is really fascinating. I thought it was a waste of time, but actually seeing this was a human rights side event. And then, of course, you have resolutions. So they had a big report on ending childhood obesity that came out, and they had a strategy, and they put forward a resolution to the main assembly. And of course, one sticking point is the whole issue of introducing taxes on sugar-sweetened beverages, which 26 countries have now done. And so here we were in the big, the glorious UN with all the Kazakhstans and all the rest. So I was there listening to it, and they started on this. And then they said, well, we're running into a few problems with this resolution. We better go into another room to change the wording a bit. So we went into another room, and it lasted 4 hours. And every country stood up and said, this is a really great strategy. We've got to do something about child obesity, except for one country. I won't say which country, but I think you might be able to read. And they were very embarrassed because they were under instructions from Trump's Washington to kill it. because the Americans never like anything that threatens their constitutional right to bear arms. And so we had all of this arguing over everything, and it was just seeing raw, naked power, and they blocked it. They did not endorse the child obesity. And in fact, they in Italy blocked the other one on NCDs. And the year before, they and the European Union and Obama's White House and the New Zealanders, all the dairy producers, killed the breast milk substitutes resolution. So seeing power up front is really, really interesting like that. It's like the academic board at UCL. So then I had to go back in, and I was sitting in my off-centre position as the director of MCA. And then they said, oh, Flavia's away, you've got to do the summary of the whole session. So I thought, this is my opportunity. So I rushed up, and the DG had gone for tea. So I got in there. Great. So I've got the photo for my grandchildren. I'm the Director General. Anyway, I gave all of this. And then at the end, an American came up to me and he said, Dr. Costello, I didn't like the way you summarized that statement. In fact, I find your British accent rather patronizing. And I said, well, actually, it's pronounced patronizing. And it means speaking down to people. That's not true, that last bit. It was a good gag. But anyway, it just brought home to me that the WHO is very interesting and important. Now, this is Afro in Brazzaville, and that's a former master's student in the middle, Felicitas Zawaria, who's the head honcho for Africa for all of... she was the head of MCH in Zimbabwe. She's been all over. She's brilliant, actually. And she was here, you remember, Felicitas, 92. And then I went down the corridor and they have an emergency room and a bunch of guys there. And of course they don't have it. Their budget is appalling. And then you find out what they're having to manage. And the red dots are cholera outbreaks, and then there was just a bit of plague in Madagascar, and then humanitarian issues in 7 countries, and every kind of new... And then they had Ebola the following week in DRC, which they snuffed out very quickly. So, you know, you suddenly think, God, this is really important. This is our global health insurance. How much are we investing in it? I'll come on to that. So then we've gone through transition. And this is Dr. Tedros, who is, as you know, was Minister of Health in Ethiopia and Foreign Minister. He's the new DG. And on my day of leaving, I went up to see him and I said, Tedros, I'm going. And he said, oh, come and have a photo. And I said, I haven't got a tie. And he said, oh, I've got a tie. And he had a rack of ties. And so he put the tie on. It's this one. And I went off with it, you know. No, he gave it to me, actually. So it's been on eBay, but I haven't had any... but if anyone wants to make me an offer at the end, I've got Tedros's tie. It'd be worth a fortune in years to come. Right. And this is his transformation team, for those that are interested. One great thing he did was clear out all us white British males and put some women in, which is fantastic. If you look there, hang on, it's that one. That is Soumya Swaminathan, whose father was the leader of the Green Revolution in India. She's a TB expert, and she's the Deputy Director for Programs, and I'm impressed by her. Very smart. She was head of the Indian Council of Medical Research. That's Bruce Aylward, who is a Canadian emergency epidemiologist. He's heading transformation. That's interesting. That's Jane Ellison, who was a Tory MP. And I thought, oh, my God. And then I met her, and what's interesting about her is she is from the north, from Yorkshire, so a bit of reality there. But she also worked for 23 years for John Lewis, and actually has a very cooperative view of management, and she's the other deputy director. And I think Tedros has finally surrounded himself, this is Lubna from Saudi Arabia on measurement, good, and Nalco, who's very dynamic on universal health coverage. So I think we've got to give it another year and see what happens with the transformation. But I'm much more optimistic than I was at the beginning, and there have been 1 or 2 blunders. I'll talk about that over, you know. No, I'm not working there now, I can say anything. And then, of course, I used to really like getting out to deal with MPs, and this was an MP in Malawi, and it was fantastic. I talked to her all about, and of course she fell asleep, which is what tends to happen when I talk about policy. But you'll see in the background there my security guard who travels with me everywhere, Dr. Bijoy Nambia. Some of you will know him. Anyway, that's an in-joke. Right. And then you meet amazing people. So this was a human rights workshop that we convened, which was really interesting. And this woman was a pediatrician, and she was full of life and bubbly and fantastic. I said, where are you from? She said, Syria. And I said, oh, what, Damascus? She said, Aleppo. And I said, Aleppo? And she said, yes, I'm a pediatrician there, and my husband is a surgeon, and we have our children. And I said, you didn't want to escape? She said, it's our country. And every day she would cross Sniper's Alley, and she would run and save, and they were being bombed and shot at, and I kind of felt so humbled. She was amazing. So you do meet these amazing people. This is Geneva ICRC, International Committee for the Red Cross. These are just pictures of Rwandan orphans who they had to fix. And it brings home that actually the UN, despite all the criticism, does do some quite useful things occasionally. And so that's what I want to talk about a bit, because it hasn't been a very good start to the year for international NGOs, with Oxfam, with One, with Save the Children Fund, and quite rightly they're getting a bit of a kicking for things, although there is an element of the papers particularly having a go at them who don't want to support international aid. So it's a double-edged thing there. This is your Have I Got News For You quiz now. Who are these 4 people? What are their names? And who's the odd one out? Right, the answers. Henrietta Fore is the new director of UNICEF, which is always an American and always in the gift of the President of the United States. So she's a Trump appointee, she's a Republican, but comes with a good reputation from USAID. To the right is Jim Kim, head of the World Bank. He was up against an African woman who had a PhD in economics from MIT, had been vice president of the World Bank, and was Minister of Health in Nigeria, and Obama chose Jim Kim, a doctor from America who happened to be Vice Chancellor of his college. So when you think that everything is done according to merit, it isn't always. Okay, it's all about power politics. America wants that. Bottom right is the former chief executive of Standard Chartered Bank that was fined $700 million for laundering money. Peter Sands, he is the new director of the Global Fund. He was up against Helen Clark, the former Prime Minister of New Zealand, and they went for Peter Sands. And you will read a letter about what he's getting up to in the Lancet from me in a week or two. And Tedros is the odd one out because he was the only one who has a mandate. He actually ran an election. WHO is the only democratic part of the UN, and he had 194 countries in a voting competition against David Nabarro. So despite all of WHO's sins, it is actually democratic. The problem is that if you look at the the broken line of aid was the biggest inflow into developing countries 25 years ago, 28 years ago. Now it is dwarfed by foreign direct investment, remittances, private debt. So the world has changed in terms of income. We could be lulled into thinking that means that they're much better off, except that actually if you look at the net transfer of financial resources, for certainly the last 12 years, there's a net transfer out of 500 billion a year from poorer countries into wealthy countries, apart from the very poorest countries. So it's not that we are pouring money into development, we're actually extracting it. And this is shameful in my view. The blue line, I did this, I adjusted to real terms dollars of 2016, and you can see that broadly since 1971, the UN has seen an increase in real terms of about double, but WHO hasn't. Completely static in terms of assessed country contributions. Remember, we're a member state organisation, WHO. We don't raise money like UNICEF and all the others. And it's remained completely static under a zero nominal growth policy, which means it's totally dependent now on voluntary contributions from Trump, And is it right that Bill Gates, who funded 85% of my department, gives 10 times as much as Germany? I think it's shocking. And I actually think it's a scandal what the member states are doing in terms of starving. And I get really sick of them coming to the executive board and standing up and pontificating. Denmark standing up saying you're not doing this and you're not doing that and you're not doing the other. And they give $4 million. I mean, that's a sort of average welcome grant. Is there any journalists here? So, and how does $500 million a year compare? Well, 16.1 billion is the amount that Amazon spends on research, and 500 million is 0.5% of Apple's profits. I mean, it's shocking when you think about it. If you value WHO, invest in it. And the fact that it's run down and hasn't got the people to do what it should be doing is largely the fault of member states, and I don't think we should blame Bill Gates. And so everyone's going to the private sector, ha-ha. And Jim Kim is talking now. He claims he was once a Marxist and now he's into all these social bonds and stuff. But the private sector doesn't give money, if you look actually at the figures. Philanthropists give money. The private sector are tied by shareholder rules. Peter Sands went to Davos and did some deals with Heineken, the second biggest alcohol brewer in the world, and Unilever. Oh, and Lombard Odious, or ODA they're called actually, but it turns out they launder lots of money, and I've identified 6 cases of money laundering, and I've written about it to The Lancet, and we'll see what happens. But I think it's shameful that CEOs of banks that were responsible for the financial crisis and the austerity mess that we've been in are being given huge health posts and doing all this backroom deals, and poor old Tedros is hamstrung, fortunately, by the framework for engagement with non-state actors, which means at WHO you can't take money from anyone, which I'm quite pleased about, actually, because money isn't everything. Right, now I'm going to talk about the lecture. Have I gone on too long? How long was that? Oh, my God. Right, sympathy groups. What's a sympathy group? Power is everywhere. We don't talk enough about power. We know from our arguments over the breakfast table where the power is in our relationships, in the hierarchies. I had the only midwife in WHO headquarters in my department, and she was roundly discriminated against and abused by all the doctors in various, well, not all of them, some were nice. But, you know, that's a failing of the organisation. We live in a class society that is still alive and kicking. There's the caste system in India. And here is a meeting in a very powerful venue to discuss the reproductive rights of women. This is 2017. So, Robin Dunbar is a cultural anthropologist, and he talks about human groups not being random. You have your family, your survival clique, who will look after you when you have your stroke, hopefully. Then there's the sympathy group. It's a tripling effect, mean of 15. And I'm going to talk largely about them because I think they're neglected in history and science. Then your affinity band, that's when you've got saber-toothed tigers and you all have to hide in the cave together with the neighbours next door. And your active network is why you have a big brain, which is the social cognitive limit of your brain, the Dunbar number, the size of your average rural village, your Christmas card list, and you can't get beyond it. And you may think that Facebook and Twitter have enlarged it, but they haven't, because he's done research on that. And if you ask people who use social media, they still have only 150 friends. Okay, so I've got interested in that. So let's go through some sympathy groups, and I'm going to go quite quickly. So hunting is a sympathy group activity, okay, when men go out to hunt, except that most of your food comes from gathering, which is also a sympathy group activity with women who would often go together in groups to sing to scare away predators. Sympathy group was the origin of Western philosophy. So Plato used to hold his symposia, which were groups of about 15 men surrounded by slaves and young women or boys. Socrates was a paedophile, it turns out. And they would all talk about philosophy and drink and all that, and then there would be debauchery. So it wasn't very different to UCL philosophy department in many ways. Then this is Siena, the social hospital. This is Domenico de Bartoli's fresco. And you can see on oh, what's happened? Was that me? Oh, right. So you can see here, there's doing a bit of surgery. There's a guy with a urine test. There's the hospital committee checking up, doing audit, an oblate friar doing end-of-life care, bit of biophilia, bring the cat and dog in. And then, of course, in the neighbouring room, another fresco in Siena. It's fantastic if you go there, by the way. There's a women's group doing wet nursing for foundling and abandoned children. Can you hear me? Is that better? And over here you've got the committee arranging the betrothal of one of the foundling girls to a local bloke, reintegrating them into society, which is fantastic. I don't think the Whittington Hospital does much betrothal these days. But, and then, of course, you have the Leveller movement. What was his name? Lilburn, yes. All about, they were the sort of primordial socialists, suffrage, equality before the law, religious tolerance, that all got snuffed out. This is the Lunar Society, Josiah Wedgwood, James Watt, Erasmus Darwin, all the great thinkers, and apparently it was led to more innovations than anything we've had since. So another sympathy group. This is the coffee houses of London that are thought to have been a major driver of innovation in this capital. Suffrage, women's suffrage. This is a suffrage group from 1892 in New South Wales, all getting together to get the votes for women. In the military, World War I platoon section, and that's still the case that the military depends upon these kind of small groups of people. These are the 15 sympathy group bombers of the World Trade Center. So it's powerful, but it can be for the wrong reasons. And also the sympathy group of Navy SEALs that killed Osama bin Laden. In Red Revolution, you had theatre groups. Mao is very interesting because in the early parts of his career, he started off as a liberal Democrat. Did you know that? And he was very interested in British politics on the radio. And then he got radicalised by a famine and the Bolshevik Revolution. And they used to go around doing lots of theatre to keep people happy on the Long March. Culture, probably one of the three most important musicians of the 21st century, Duke Ellington, who I actually saw at the Hammersmith Odeon and at the Rainbow Theatre, 2 occasions. Fantastic orchestra. Sport, we're all in sports teams or support them. This is Barcelona. I support Millwall, which is not quite the same. And then, of course, theatre. In Western civilization, sympathy groups. This is Peter Brook directing The Tightrope. And politics, topical. President Putin with his... Actually, there's a professor of Russian studies in UCL, Professor Ledeneva, who wrote a fantastic book about modern Russia, and the Sistema, and all of the 15 people around Putin that then ripples out into other circles and sympathy groups. And of course, Trump does the same, and Theresa May must have a sympathy group, mustn't she? But I'm not sure who's in it. So what? The members of sympathy groups are, by definition, beneficiaries or enablers or neighbours. And it's not civil servants or outside NGOs. It's got to be led by the people who have a vested interest. So it follows the Adam Smith rule, if you like. And the processes are you have a focus, you iterate a lot, you build trust, and you implement strategies. So that's what I think it's all about. And I don't think we do enough. Now, I'm going to talk now, but very quickly, about work that a lot of you have heard about in the past. Meerkats, bush-tailed tamarins, and humans all do cooperative nurturing. It takes a village to raise a child, but chimps don't. Chimps are kind of autistic and a bit... I shouldn't say that. That's bad, isn't it? No, you mustn't say... I apologise. They are a bit... They don't like people. And autistic people do, so that's completely wrong. I get told off. But they don't let people hold their babies. It's very interesting. Right, so we did this study when we were first learning about randomized controlled trials in the 90s, Kathmandu, very straightforward health promotion thing, 2 doses, 45 minutes each, one as women left the hospital, one as they were in their home, about infant care, and it had no impact whatsoever. So all the stuff we kind of thought about didn't seem to be really true in a trial. And then we heard about this project in Bolivia, the WARMI project from Lisa Howard-Grabman, who'd set up working with women's groups, but they hadn't evaluated it in a kind of randomized way. So we wanted to set it up in Nepal. So we found a district, Makwanpur, about 7 hours from Kathmandu. We gave them some cameras, and this is their life: subsistence agriculture, delivery at home, and mainly going to traditional healers and shamans. You probably know about PLA approaches, meetings to discuss the problems, then plan the strategies, put them into practice and evaluate them. And it takes 18 months, and it's a community action cycle. We did a cluster randomized trial in Makwanpur. The blue was the control, the red the intervention. The epidemiologist sitting here will say, well, there was a lot of contamination there, wasn't there, between red and blue women's groups. But God designed Nepal for cluster randomized trials, because the yellow borders are all raging rivers or 15,000-foot mountains or something. So no contamination. We actually did measure it at one stage. And then we had, so these kinds of peer groups meeting, and it was pretty clear that this could not possibly work because we didn't have the right dose of women joining the groups, except we hadn't worked that out properly. We didn't realise that a lot of pregnant women selectively joined the groups, and those that didn't were visited at home. So social things are a bit strange, you know. And we showed this big effect on neonatal mortality rate after 3 years. And so celebrated, published in the Lancet, all that stuff. And nobody paid a blind bit. But yeah, well, it was Nepal, dodgy, Costello, you know. I mean, it's, don't really rate that, needs to be replicated, all the usual stuff. So it was replicated, and Professor Audrey Prost, who defected from UCL, and how dare you, Graham? We'll have to get her back. She's at the London School, sitting over there. Helped with this fantastic trial by another former master student, Ekjut's leader, Prasanta Tripathi, and his wonderful wife, Nirmala Nair. And that showed a similarly big effect in a slightly better designed and bigger trial. And then we got the mathematicians involved. So Christina Pargall from mathematics here came up with this clever way of showing the time lag after the start of the trial before you get the difference emerging after about 9 months, which is very plausible for a social intervention. And then we went mad and spent 10 years doing 7 trials, which I won't go into, in Malawi, in slums of, where's that? Mumbai, India, yeah, and Bangladesh, and etc. And I should acknowledge that this was very collaborative efforts. It was fantastic because working in teams is always fun. And actually that's how you do research these days. And the interesting thing was the negative trial, because Bangladesh, after the 2 successes, showed no impact. And they all cried. And Kishwar Azad, she runs the program and is quite a scary paediatrician, kind of pinned me up against the wall and said, how dare you, what's wrong with us? And I said, well, maybe Bengali women don't chat. Don't chat, we chat for, you know, better, we'd be at the Olympics for chatting. Well, maybe you don't network with people, you're very conservative. We're not conservative, women know what they're doing. Why is this wrong? You've humiliated Bangladesh. And I said, no, it's science, it's a randomized controlled trial, you don't, maybe we got the dose wrong. So we worked it out, and we had got the dose wrong, because Bangladesh is quite densely populated, and we didn't have enough women in the groups. So then Ed Fottrell came on board, we tripled the numbers, we ran it for another 3 years, and we showed an even bigger effect than the other 2. And Kishwar kissed me and said, oh, it was fantastic, oh, it was brilliant. And it was the dose, we just got the dose. Right, and then Audrey Prost did the science bit and meta-analysed everything. And we worked out a kind of threshold of who attends the groups, and we showed these big reductions in mortality and also maternal, although it wasn't primary hypothesis of the trial. So we have to be a bit careful in interpreting that, but there's a lot of plausibility there. And more important, we then took it through an arduous process with WHO to get facilitated participatory learning and action cycles as part of their guide process. Took 18 months of hell, and we got savaged by brutal epidemiology. But we came up with a strong recommendation. So we can now go to every ministry. And this woman, lower left, who is Arti Ahuja, who was Secretary of Health in Orissa State, which has 45 million population, said, I really like this, we're going to do it with government budgets. And she scaled up 130,000 women's groups. And now the Chief Secretary to India said, yeah, great idea, we're going to do it in 8 states. And Audrey is actually coordinating a big scale up in Jharkhand, the original place. And you should get her back to talk about it before we kidnap her and bring her back to UCL. Right, and there is a biology to all of this, because being in a group reduces stress, because groups, the original thing about groups, is that they were grooming. You know, we're all primates and we groom one another to reduce stress. And Michel Audin, you know, the French obstetrician who introduced water baths to Belsize Park. And I went to one of his antenatal groups, it was great. And he said, it is oxytocin, it is the hormone of love. Orgasm, you have a spike of oxytocin. Anyway, and that's actually, it's the nurturing hormone and all that stuff. And I've got this study I really want to do on Millwall supporters and oxytocin. If anyone's looking to come and help me on this. Anyway, right. And groups protect you from shocks like landfalls and floods, and you get consumption smoothing. In other words, if you're in a group and you've had a hard time, you've got somebody who will go and share something. And the economists from IFS have been all over our data on that. And then when the Nepal earthquake happened, we went and resuscitated a lot of the groups we long ago left, and they were all still running, and they were very supportive. And we've still got some qualitative data to look at. So finally, I don't think my alarm's gone off yet, so I haven't been going 40 minutes. How might we use this kind of approach to tackle 21st century problems? And the plug is that I have got a book coming out about this in about 4 months' time. And I've speculated, having described some of this that I've spoken about some of the issues that we should be doing a bit of science on some of these issues here that I think are rather important for development, from loneliness all the way down through corruption and climate change to the culture of finance and economics. So I'm sure I'm going to upset quite a lot of people, which is good. I like this quote from Christopher Hitchens: that which can be asserted without evidence can be dismissed without evidence. Deming said the same: without data, you're just another person with an opinion. And finally, I like this. This is a Nepali tweeter. The idea that the solution to an economic, political, social, or humanitarian problem is to build a website. Or we've got an app. We can solve climate change. So I think we do need a bit of social science. And I think this is one that we should start with. The figures are really scary. 7.7 million over 70, hugely increased risk of depression, lots of people totally isolated, huge costs in social care and prescribing, and guess what? Not a single trial done on a population approach to social isolation. Yet we're spending billions on Hox-Pox-Cox genes of the, lesser spotted syndrome. And and smashing particles up. But no, we can't actually do something to solve what's affecting most people in old age. And yet men's sheds in Australia, which bring men together. I mean, I'm useless at this, so I won't join a men's shed now that I'm retired. But, this is, I think there is a trial going on at men's sheds. There is things happening in Australia. There is a trial. I don't think Ed Fottrell's here because he's got children and he's sensible. But we're doing a big trial and we're getting the results next month after about 3 years of working on group approaches with men and women to diabetes and hypertension in Bangladesh. And of course, there have been work done with self-help groups and the like in the West. This is interesting. So that bloke, Peter Wolf, on the right is a career criminal. And on the left, Will was living in Kensington when Peter Wolf broke into his flat or house about 8 years ago and attacked him, and they had a fight, and Will was bigger than him, and he got arrested. And 2 years later, a friend of mine runs a thing called the Forgiveness Project, which is really interesting, and they did a restorative justice thing, and they brought them together. Peter Wolf said, yeah, I met you before. And he said, no, we didn't meet. You were robbing my house, and I had to pin you down. And then my family have suffered for the next 2 years with stress and anxiety. And Peter Wolf went away and thought about this back in prison and suddenly realised that although he'd been an abused child and a delinquent and been in and out of prisons 10 times, that he'd never actually thought about his victims. And then he got interested in all of this, and he then decided to get involved in restorative justice. And I said to him, I went to a meeting and I said, what did you do when you were discharged from prison? Did you not have a probation officer? He said, no, you'd come out, you'd know where to live, your mates would meet you, you'd need a snort of cocaine, so we'd do a shot within about 6 hours of leaving the prison. So the idea I have is that it's ridiculous we're not building groups of ex-cons who know the problems about jobs and accommodation and actually do some systematic approach. And I think we should do a randomized controlled trial to look at some of that. Quality of relational care, one of the only things I achieved at WHO, but I'm quite like, is the fact that we set up a whole network of quality of care in countries for maternal and newborn health and child health, and it was country-led. It has to be country-led, no kind of donor-driven stuff, and that's working very well. But one of the big issues is dignity and respect, because an awful lot of women are getting to facilities and then being shouted at and smacked and not treated well, and this kind of condition. The other thing is the basics, that many more people have mobile phones than toilets. We've totally failed on the Millennium Development Goals for sanitation, and there's a massive issue there. And of course, that is intimately linked to antimicrobial resistance. And of course, everyone wants to invest in new drugs. We've got to have new drugs. Why not washing hands? Might be a good idea, because only 2% of people in Bangladesh, health workers, and in northern India actually wash their hands. So Semmelweis's advice of 1851 is largely ignored in most countries. So isn't that something that we might approach with a slightly more community engagement approach within hospitals? And ownership is very important. So working with, for example, ward groups here, I mean, this happens a lot, and I think it is evaluated, working with adolescents who want to have a slight say in their healthcare. And of course, this is an example of an Australian health committee that was very successfully monitoring the work in a local hospital. It's just they're a bit out of fashion, these Australians, aren't they? I mean, I think it may have been taken 5 years ago, so we can explain it. But social accountability is talked about a lot and very rarely done, and there isn't a science really ascribed to it in a way they should. What is odd, your question, this is to keep you awake, about this picture of a neonatal unit in Delhi? Well, I won't extract answers from you, but the interesting thing is that the nurses are all mothers. And this is the work of Arti Maria, who said, why are we, we're always short nurses and stuff. Let's train up the mothers, and she does this thing called family-centred care, which is economically sensible. The first thing that they do is train the mothers up and the fathers, and I was incredibly impressed when I visited that in Delhi, and I think it's got a huge potential for scale-up. What about early childhood development? That's James Heckman, who some of you will know won the Nobel Prize in economics. Not really like some of the other Nobel Prizes, but anyway, if you invest early in life, you get a big return. And I was talking to Awakol Sek, who is the minister from Senegal, who said the biggest challenge I had was to persuade the president and the finance minister that you don't just run the economy on some economic theory, but you do it for human capital. Because that's how you solve all your problems. And look at, I've come back to my country and everyone's homeless on the streets and child poverty is rising and everyone's going to food banks. And what the hell are we playing at? Sorry about that, I lost control. Breastfeeding is a spin-off. Breastfeeding, we're at the lowest rates of exclusive breastfeeding ever in our human civilization. And we're up against a $70 billion industry, which is not easy, and social trends. We know that the brain develops throughout childhood, physically, biologically, and we need to do much more about that. Yet very few of the poorer countries have any kind of consistent plan about child development initiatives, and this country seems to be de-developing in that regard. I've had 3 of these people called adolescents through my household. I did a study of n equals 3. And most of the time they are got white teeth and very nice, but sometimes they're like that. But the thing about adolescents, and I'm going to give you a tip here because I've had 3, they love only 2 things. After about 12 or 13, they don't love you anymore, except around Christmas and when they need money. But they do love 2 things. They love peer groups and mobiles. And therefore, we should be exploiting that. Now, everyone, Bill Gates goes, mobiles, yes, we can do mobile. But peer groups is actually what really motivates them. And we could do a lot more to explore ways in which adolescent peer groups could change behavior. Because the figures are scary. 80% of the world's adolescents don't have enough exercise. Nutrition is bad. Smoking, alcohol abuse all starts then. Nutrition, sexual health. Of course, you know, if you're a donor from Europe, or it's sexual health, they need to talk about condoms. We've got to talk about sex with adolescents. And then all the parents in developing countries say, no, 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 you can't. Like my mother, you know, you can't do sex. It's not allowed. And so what you actually need is an approach that combines all of that. And actually, most adolescents don't like to talk about sex first. They want to talk about pimples and weight and all the rest of it. So I think we need to do more of that. And there are initiatives, but they need to be evaluated around working with groups that can be either gender mixed or not. And I think this is a scandal. You know, 2% of us will go psychotic at some stage in our career. No, our lives. And, well, in UCL, it's your career. And half of all psychotic episodes show symptoms before the age of 14. And I've got a near neighbour whose son, brilliant, went to Cambridge, dropped out, smoked cannabis a lot. 15 years later, psychotic, sectioning, attacked parents, no relationship, total disaster. And I spoke to someone at his primary school and he said he was always a loner. And there are early signs that could be picked up, and would early intervention with groups and trying to make, I don't know, but it just strikes me that nobody's done this work. It's the Hox-Pox-Cox gene of, you know. Right. Then corruption in health. We're not allowed to talk about that at WHO, but I'm out now. Bribe for everything. This was the headline in Bangladesh when I went there. A license to loot, the Cashgate scandal, where the Treasury ripped off virtually all of the aid money going into Malawi, which has stopped all aid money going in. This is Kenya last year. I went through the airport and they were talking about how $50 million had been siphoned off the maternal health budget into companies that had an uncanny link to certain people in high office. And this is a former Lancet lecturer who was sacked for corruption. And the Medical Council of India apparently is largely responsible for corruption in healthcare. And just to balance it up a bit, the NHS, $7 billion. No, that's pounds. That's more, $10 billion a year. So corruption is a systemic thing. And I think that actually it's about systems and people scrutinising things. And we're back to sympathy groups. I think we could do something there to look at ways of strengthening the system. climate change. What's the time? Oh, am I over time?
Yes.
Oh God, I'll stop. Let's go through all of this. No, we're in big trouble. You all know that. We're a bit stuffed. Let's skip this. We know we've got to do something about it. We've got a Lancet countdown process. We're heading towards 4 degrees with a 93% probability at the moment. And you've seen what's happened to the weather with just less than 1 degree warming. It's a big issue, but groups have a role to play in changing our practices and sustainability. And also in finance, I'll leave you with this, that in America, they run their Federal Reserve on the basis of 2 indicators, inflation and unemployment. They would not accept what the European Union has accepted over the last 10 years, where they've run a crazy German-centric policy which has led to mass unemployment of young people in southern states. And I think it's an utter scandal, and it's a public health disaster. And the economics of health, we're always told about the economics of health. What about the health of economics? And I think we have to confront a lot more of these decisions and do something about it. And I'll finish with this, with my Twitter account, if you so wish. I've now got a new blog. It's not very good because I've only just opened it up, but I'm going to do some podcasts. And if the book does eventually come out in summer, I hope you'll review it on Kindle and don't slag it off too much. Thank you. I'll go for that.